I think if we recognize that chronic pain is a progressive condition that gets worse over time, the sooner we get there, the better the outcome in a regenerative environment. And what I mean by that is, a lot of patients, their first step or the first direction they go in when they start to develop symptoms, because symptoms are the warning sign, right? Symptoms are our body's way of telling us that, hey, there's a problem or things aren't functioning the way that they should, and maybe we should pay attention to it. The problem is that in the beginning stages, the symptoms come on, and if we ignore them or if we have some rest or if we stop doing what we're doing to cause those symptoms, it tends to go away. And then we think that the problem is solved. But that's really the beginning stages of a much more serious problem that will develop over the course of their life if it's never addressed in the proper way. In the beginning stages, we may not have to do anything invasive. It may just be, an education for the patient where we teach them how to do mobility. We teach them how to do specific exercises. We teach them that, what they're eating is creating an inflammatory environment that's breaking down their body as a whole. And it's much easier to solve problems at that stage of the game. But then, typically what happens is once the pain comes back and they can't get rid of it with rest, let's say, then they enter the traditional model, and really it's the introduction of drugs to manage symptoms. And at that point, that gives them a false sense that they're doing better because the symptoms don't exist, and then allows the condition to get worse. So, if somebody comes to us at that stage of the game, it's really just about education. The easiest time to fix a problem is when it first starts to develop, especially if it's a chronic problem, right? And that's one of the things I try to instill in patients all the time, but that's not always the case. Patients usually don't come to us until they've failed in multiple other environments. Those tools and resources aren't working. Their life is getting worse and worse over time, and they can't do the things they love and enjoy. And that's why they look for, what I like to say, quote unquote, alternative solutions. And that's how they find us. What I usually tell patients, when we're evaluating patients and selecting them, like which ones are going to really do the best in our clinic, because we have to select patients that are going to get better. It doesn't serve us if we can't, move the needle in a condition in terms of how they present. So what I usually tell them is the biggest variables, look, the extent of injury. You can't unboil a hard-boiled egg. So waiting for the condition to get to end stage to try to solve that problem in this environment may not be the best option. And there is a time and a place for drugs and surgery. I talk about this all the time. If somebody comes to us just because they totally disagree with surgery or they don't like medication or whatever it may be, that's okay. Sometimes they need surgery. They come to us with a full thickness rotator cuff tear and weakness in their arm, and they haven't been able to lift their arm for 6 months. That poses another set of issues, and they may not qualify for surgery at that point. The best thing I can tell them is get evaluated, right? Be proactive. Whenever you have a problem that is out of the norm, listen to your body, heed the warning signs, and essentially, go and get evaluated so that, you can get in front of it sooner rather than later. Do you have any questions or comments? Please comment below. We'll be happy to answer your questions and tell you more.